Yeah.
Okay. So yeah, let's get going. So I'm Matthew Meze, the community manager of the Q community, a network of 4,500 people involved in improving health and care. And I'm with Diane Ketley. If you want to quickly introduce yourself, Diane.
Yes, good afternoon, everyone. Thank you for joining us. I'm Diane Ketley from NHS Horizons, which is part of NHS England and Improvement.
And as Diane will be explaining, she's the author of Leading the Spread and Adoption of Innovation and Improvement, a Practical Guide, but we'll be getting into that. And Jorian is also organising this with us. Do you want to quickly introduce yourself, Jorian?
Hi, hello folks. Is my microphone working now?
I think maybe Jorian's lost sound.
Oh no.
Oh no.
Oh no.
Oh
no,
he's there.
Oh, am I back? Okay, cool. Hi everyone. My name is Jorian. I am the catalyst support for Q. I help with the SIGs, and in this call here, I will be your tech support. So if you have any sort of issues, or if you have any questions about the tech, please send me a DM. But I'm here mostly to enjoy and prepare your breakout rooms.
Thanks, Jorian. Yeah, and if as Jorian was saying earlier, if you haven't done so already, please introduce yourself in the chat, your name, your location, and what excites you about today's topic. Great.
Excellent. Well, I think thank you, Matthew. I think we'll kick off the main section here. Can I just check everyone can see that slide now? That's looking all right. Is it good? Lovely. Thank you. So what we're aiming to do this afternoon is explore these two recent publications. The first one on systems convening from the Wenger trainers, and the second one from NHS England and Improvement, produced by NHS Horizons, which is the one on the right there, Leading Spread and Adoption of Innovation and Improvement. And to give you a brief overview of both of these, and then to explore how these may sit and mesh well together through a focus of the spread and adoption of innovation and improvement in health and care. So that's our aim. What we're going to do is give you those overviews, have a bit of a discussion, then go into breakout rooms so you can reflect on what you've heard, think about how that might apply to your work, think of any questions you want to bring back to the group for the end. So we've got a fun hour, so I think on to the next.
Yeah, so I'm just going to say a few quick things about the book before we'll hear again very quickly from Maddie and Isabel if she's here. I'm not quite sure if she's joined yet. Yeah, so I'll just kick off. So I mean, one of the really important things to note about the book is that there's not one person in the book Systems Convening who would have said, I'm a systems convener. They, and yet they're doing all this work, working across silos and boundaries, enabling new conversations, spotting unrealized potential. These people are all kind of restless to make a difference where it matters. And they're both, the systems conveners are both kind of visionary and pragmatic in order to make that difference. They're playing a kind of a long game. And another one of the characteristics that the Wenger trainers noticed about systems conveners is it relates to hierarchy. The systems conveners aren't usually at the top of the hierarchy, with positional power and so on. They're closer to the ground and the realities of practice and to the relevant kind of networks and communities. And something else that also really came out in the book is that this systems convening work can't be done in a detached way. It involves head and heart. And in fact, the people in the book didn't have a choice because of their hearts. Etienne was saying recently, they kind of had to do this work. And another thing that comes up, regularly as a characteristic is that 99% of the time, the systems convening work kind of goes largely unrecognized by the organizations. It's not in these people's job description. I could see that the most impactful, worthwhile things that I'd done, like convening a small group of people that didn't know each other, that eventually created time NHS Time Bank, things like that were better or other kinds of activities. And interestingly, the book itself really came out of systems convening, you know, bringing together a diverse group of different organisations, none of them connected to the Q community, and then working with Q members like Diane and others to try and find the funding. And one other point I wanted to make from the book, and I hope you've all downloaded it. You can download it for free, and it's very cheap, the hard copies through Amazon as well. But another point of the book is that it's only a first step. You know, in future, the Wenger trainers were saying, you know, there might be case studies or guidebooks or workshops, all kinds of things that would be valuable that will emerge. So this little book here is really just a kind of a first step. What I was going to do now was hand over briefly to Madeline, to Maddie and Isabel, just to say a little bit about what systems convening means to them. And Maddie was one of the people profiled in the book. So over to you, Maddie, for a minute or two.
So hi, everyone. So my husband's turned the telly on downstairs. So first for me, I think what happened is systems convening gave a name to it. It also gave me an answer to the question of, well, what exactly is it that you've done? What is it that you do? When up until this point, I'd really found it difficult to describe the connecting, the joining the dots, the seeing patterns in between organizations, programs and people. So the first thing it did was give me a name for what I was doing. And that was really, it was a really sort of grounding moment for me, because it sort of legitimized what a lot of people, well, I believed a lot of people thought was the fluffy stuff that Maddie does. And then as we started talking through that systems convening could be a framework, that again, it added a level of layer of forward. So internally, I felt empowered that I was doing something that was real, not just following my heart. As Matthew pointed out, there's a lot of us that do this from our heart. And so it gave me that framework. Now, anyone who has worked with me will know I like my framework to be pretty loose. I don't like to be tied in. So being able to flex through this framework is really important to me. So for me, it's not a blueprint. It's a starting point. It's some steps that you can follow in any order that allow that sense making to happen, so that transformation can then kind of fall out of it. And finally, I guess it's given me an opportunity through the conversations and through reading the book and connecting with other Qs and other people around it. It's given me the opportunity to keep challenging myself as well. So it's allowing me to think, well, maybe I need to bring this framework in here. Maybe there's more to keep learning. And maybe it's okay for all of us to think about this and keep looking for those patterns and talking to people. And I think that's the magic that systems convening means to me.
Yes.
Thanks, Maddie. Isabel has...
Matthew, sorry I'm late. we just got CQ-seeded, so like, you know. So can you hear me?
Yep, we can hear you. Go ahead, Isabel.
Right. Sorry. So what system convenings means to me. So for me, it's different from the kind of like traditional hierarchical way of work. Really appreciate, like, you know, intelligence of you know, for me, and you have to be really open-minded and accept you know, the crowd will always bring some creative in, and you have to be ready to kind of accept that and, you know, embrace it. So that's one thing. Things for me as a system convener, it's very, very important to close that feedback loop. I think very often we struggle, like, you know, we know there are so many things to do. Sometimes we're not able to necessarily make progress in the kind of like in a timely manner or in the kind of like speed that we like. But it's extremely important to kind of like carry on that conversation, even you're not making any progress or not able to improve things imminently. It's still very important to carry on that conversation so that everyone is on the same page, you know, with you, or as much as possible, so that, you know, you don't start having, you know, people they are completely on a different page, and it's very difficult to catch up, you know, later on, and then you also lose the kind of engagement and the trust of your group member or in the network. So that's another thing. And I think the other things for me that's very important is like, I think you don't get paid to do this very often. I think, you know, after reading the book, a lot of things like, you know, require the system convener to have that kind of like personal drive or motivations to do something differently, or incentive or like financial reward, or, you know, I think some people, you know, they might be in but there are also a lot of the system convener then necessarily have to support them, so they have to be so kind of like, I guess, creative in a way to pool resources or like knowledge. Yeah, so I think that's the penny.
Fabulous. Thanks, Isabel. I think it's over to Diane now to talk about her new publication.
Yes, thank you, Matthew, Maddie and Isabel for that. So hopefully that's provided an overview of systems convening in a very brief way, but hopefully a good introduction for those who might be new to it. And yeah, as Matthew says, highly recommend the book that's newly out. So the second recent publication that we said we wanted to cover is this one here. So this is, as you can see from the title, is about it's an offering to help people who are trying to increase the spread and adoption of innovation and improvement, and trying to make this in a very practical way. So about 7 interconnected principles, which I'll touch on in a minute, and systems convening, so this is the link, a practical tools section and methods, case studies, and further resources. So that's those are the 6 components within the guide. So what is it? Well, it's a set of web pages on NHS England and Improvement's website, offering a synthesis of knowledge and experience to help increase spread and adoption. It's aimed for basically anyone who's interested in increasing the spread and adoption of innovation and improvement from a local level right through to a national level in health and care. So that's who it's aimed for, so very broad and generic, and was published at the end of September. So why produce this guide? Well, I think this sums up what we often see, certainly in the NHS, and that's these isolated islands of improvement, whereby we have these excellent islands of excellence, but it's not spread throughout the whole of the service. So we have a lack of spread and adoption. And I've heard it asked many times, including by several ministers, well, why, if something's really good and it's done in this place, why isn't it just done throughout the whole of the NHS? And in some ways that is, well, it is a very obvious question, isn't it? And it's a very simple question. The problem is making or enabling that to happen is hard, which is why it doesn't happen readily. So the approach we took to produce this guide was to acknowledge that, well, we need to be thinking about this in a different way, because if we keep on doing what we've always done, we'll always get what we've always achieved, and that is spread, but not to the extent that we're after. So we took an approach building on the experience, the knowledge, the publications that already existed, and took a view through a lens of complexity science, produced a prototype and tested that with staff before going to publication. So that was the process and the rationale for producing the guide. So one of the 6 main sections is one that offers 7 interconnected principles. And I'd like to just quickly whiz through those. Lots more detail in the guide and in a series of blogs on the Horizons website. And there's details on the last slide of further resources. But these 7 interconnected principles for spread and adoption are illustrated here. So the first one, top right, complexity, and then complexity. That the important point here is the spread and adoption of innovation, improvement in health and care is the complex acts are, and therefore what we need to do. That the leadership we need to be considering the perspective of the individual, whether that's the patient, the staff member, the carer. What is their perspective? And that's really important. What might they gain? What might they lose? Benefit. It's really important to be focusing on what is the benefit of this improved tiny gizmo. It's the staff, and that ties in very well with the adopter focus in the work around spread and adoption, about what we're asking the involved early, get them feeling part of the individuals. Of course, the Q community is a fabulous example of that. And then we seek and we share knowledge as routine. So a very quick run through those principles. They're principles, they're not, these are things that you have to do. These are things that are worthy of consideration. So just a few words on complexity, because I think that's a really important point, that spread in health and care is a complex activity, and we can see this complexity around the innovation, the process that we're going through to try and enable the spread to happen, and also in the context that we're working in, the context that the spread and adoption is occurring in. And working in health and care, we're working in a complex adaptive system. So what we know from complexity science is that we need to match the complexity of the approach that we're taking to spread and adoption, and that's our frame for today is spread and adoption. We need to match the complexity of the approach we take to the complexity of the situation. So if we're working in a complex situation, we need to have an approach that recognises those challenges and can work with that complexity. So not a simple kind of mechanistic approach. Just to be clear what I'm meaning by complexity here, this is often a useful illustration. If we look at simple, complicated and complex, simple is something that has a number of steps that's been developed over time and that you can replicate. So like baking a cake. Complicated is simple, but lots and lots of steps, lots of experience, lots of learning that goes into it. So it doesn't mean it's easy at all, but if you follow the steps, you're very likely to get the end result that you've had before and that you expect. However, with complex, you haven't got that predictability. You might have things that you should do and shouldn't do, but there's so many factors going on, so many variables interact together that predictability is very difficult. And it's in that area that system convening, I think, is really potentially very useful. So what do we need to work with when we're working with complexity? We need to be able to work with that uncertainty, that emergence, the unpredictability, and it's very much about working with relationships. And again, this all matches very well with systems convening. So the second principle just to touch on is that of leadership. And I mentioned that what we say is that an enabling leadership style is needed. And this is one that enables interactions between key people to develop those relationships and that can create the environment for innovation, development, spread and adoption. And it's about knowing when and where to bring people together in an adaptive space, which I'll come back to in a second, to maximise those connections, to build that support and to do this in a strategic, intentional way. So a quote here from Mary Albin, I'm a big fan of her work. She talks about enabling leadership style, and this is her quote, and she says it requires a mindset shift such that my role is to think about how I can facilitate and enable adaptation, emergence and change rather than directing people what to do. So I think there's a really good resonance there with what we've been hearing about systems convening. So that's a very quick run through, overview of the guide to spread and adoption. So Matthew, I think it's back to you now for our next section.
Yeah, thanks, Diane. Next thing that we wanted to do was actually to ask some questions for you. And the first one I've got was, how does systems convening and the spread and adoption of innovations tie together, these two different areas? How do you think they kind of link together?
Yes, well, hopefully I've tried to cover that as I've gone through the presentation, pulling out from the guide things that are specific to this session this afternoon, and that there's a lot more in the guide, as you can probably tell. But this slide is one that I use very frequently when talking about system convening in the setting of spread and adoption of innovation. And people out in the service usually find it very helpful. And this is building on that previous slide around simple, complicated, complex. So if we have a change that is complicated and maybe independence abounded, an approach, a leadership and organisational approach around programme management may well be sufficient. And the programme management that we're very familiar with the activities that are illustrated there, designing a plan, ensuring delivery milestones are met, etc. great. However, if we have a change, an innovation that's to be spread and adopted that is complex, as most of the work that we do now is, and has interdependent components, then what we need in addition to the program management is to work in a system convening way. And what that means is working with emergence, building a collective goal, building the relationship, the system, and the implications there. So it's not that one approach provides situation, but that complex changes and complex spread and adoption of complex innovation together, both bringing really valuable contributions to enable spread and adoption. And that these are, I see as activities, not necessarily roles. Okay. Oh, I can see a heart there from Maddie. That's good.
Okay. Thanks, Diane. And there was another question I had for you, which is you mentioned Mary Albin's work about the importance of adaptive spaces and creating adaptive spaces. And I just wondered, you know, how you think what you've been talking about links to Mary Albin's work.
I think it links really well. Adaptive space, I did just mention, and I knew I was coming back to here. So what Mary talks about, and yes, I'm a big fan of hers, having been introduced to her work through the Q community, as that's been a real plus for me. And this diagram is taken from her work. And what you can see is she talks about creating an adaptive space, which can be virtual or face-to-face. It's usually a temporary space, but it links and it connects what is called here the entrepreneurial system. So that's the innovation, the new development area with the business as usual area. And what we often see is there is this huge chasm or gap between the two. And by producing an adaptive space, these connections can be developed. And I think that this adaptive space, what's required to develop that and to enable good work to be done within it are many of the characteristics and the activities that are described in systems convening. So I'm not saying they're necessarily exactly the same, but there's certainly, I think, it's a good way to understand the concept that systems conveners are bringing people together across boundaries to enable conversations and connections that otherwise wouldn't have happened. And that this works to allow for emergence and information flows. So I think the work connects across really, really well.
Thanks, Diane. And I think you said you have some of your colleagues that are actually kind of doing this kind of work on the ground that you wanted to bring in to share how this kind of thing works in practice.
Well, I do, yes, but when I start, it's my voice. I don't know if Joey can help there. What I was going to say is, yes, that's kind of a bit theoretical. What about systems convening and spread and adoption? And I work within the Horizons team in NHS England Improvement. Much of the work we do is work as systems conveners at a national level. So if you're interested in learning more about our work, then our website has information, or I'm happy to talk about it another time. But what I thought would be helpful is to call upon some colleagues who were good enough to contribute case studies that are embedded within the guide, to just say a few words about what system convening and spread and adoption means for them in their work within the NHS. So Carrie Mackenzie, do we have you on the call? Jorian, do you know if Carrie's managed to join us? She said she would if she could. Obviously working in the service, things may have cropped up to prevent it, but I
can see Carrie or Anand or Barney.
Oh, right, okay. I have no shows then.
But hey, there was an interesting question in the chat from Bianca, and I thought that we should put this forward. Maybe that's a good opportunity.
Yes, maybe I could just quickly run through their work because I know they wanted to be here. And then Joey, just in my last minute or two, we can maybe come back to that question. Yes, of course. So Carrie works, as you can see, in NHS England Improvement Voluntary Partnerships work. And that's what I do, is the title of the blog, which Carrie has written with us. And it's entitled that way because I think, Maddie, you said something very similar. When I presented about systems convening, probably 2 years ago now, so pre-book, and Carrie came rushing up at the end and she said, "You've just described what I do. No one understands it, and now you put a name to it." Was very, very excited about that, understandably. So it would have been great if Carrie could have joined us to give her perspective. But you can certainly read about it on within the guide and on the Horizons website. And the second one is a group of people, and I wasn't expecting all of them, just Anand. But again, they're working in the front line in the NHS around the Rapid Diagnostic Centre in the cancer unit. And they have written about system convening combined with programme management. And Anand, I think, feels he provides a lot of the programme management activities in that Venn diagram, and Barney's a lot of the systems convening, but there is an overlap, it's not exclusive. But what is really great in the blog and the video and short video they've created is the way they work together. And I'd really highly recommend it. All four of them working across organisations for a common goal, and how they did it and how they managed to achieve what they've done. It's really good to hear from people who have used these approaches in practice and had great success from them, and other examples on the website there. So yeah, Joey, in my last minute before we go to breakout, you said there was a question.
There was a question in the chat. Bianca, are you still around to ask a question, or should I ask?
Yeah. Hi. Hi there, Matthew, and everyone. This is an amazing session. Just listening to you, I feel like I'm living this experience. And I had a question for you, all of you really. So I am the Humphrey Care Quality Improvement Lead, and I love all things quality improvement. And what I'm finding as a program lead is often the program management, the slide, a couple of slides before, where you showed there was an overlap, the sweet spot in the middle where program management and systems conveners, have to come together and find the balance, what overtake and program management goals overtake, like as if there's such a fast rush. There's a fast pace to achieving those goals, and to build agency, I think it takes time, because so how do you tackle that when program management takes over systems conveners? I guess that was really my question. What would be your top tips?
That, isn't it, that complexity does take time to build trust and build those relationships, but often that's not the time that we're allocated. So it's a balance, isn't it, between the two? And I'm not sure that I can give you in a few seconds the top tips. I don't know, Matthew, if you or Maddie or Isabel want to try and do something in a minute. Maybe it's something for further discussion in the future. In terms of being able to share, because I would imagine there are other people on this call who've got some practical advice, and certainly Barney and the people here would be, I think, better placed than me to give advice. But from within the community, it'd be fabulous if we could share. responses to that question.
We do have breakouts starting in a moment, so actually that might be something in Bianca's group, and maybe other ones as well. There's a question to kind of to answer there and bring our experience to. I don't know, Jorian, do you want to lead us through the breakouts?
Sure. So folks, I'm going to send you to groups of approximately 5 to 6 people. And what we had in mind is exactly that question you see on the screen right now. How does it resonate with you? How does that link between spread and adoption and systems convening feel to you? Does that align with your experience? Is it different from your experience? Is there any pattern you can recognize out of that? And especially, how might you apply this to your practice in the real world? How do you get this knowledge from this call here, these topics that we're talking about, and you bring it to a place of practical application? So we would especially invite you to try to bring something back, something as practical as possible to the conversation when we're back from breakout rooms. And let me just check the time here to see for how many minutes you will be there. You will be there for approximately 13 minutes. So let me create those rooms. Let me make sure it's the right amount of time. There you go. And I'll see you in a couple of minutes. Cheers. Diane, I looked at the watch and I realized we're ever so slightly. Oh, Diane's out.
So, hey, Jorian, wait, who's in? Wait, are there seven people still here with us?
Yes, they've all been assigned to breakout rooms.
Maybe they've wandered off. Rob, Mandy, Francis, have you got an invite to go into a breakout room that you've not responded to?
It's all right. Sometimes people are just particularly looking somewhere else when I press the button and they come back in 30 seconds. Then they see the invite.
Excellent. Yes. If each breakout room can bring home. Good. It's glad that people have enjoyed meeting others and finding it useful.
I'm not sure whether Alison's message, Helen Bevan, is like a question, conclusion.
Sorry, that was a response to a question about someone that I follow on Twitter, which is why this climate funder ended up in an NHS session, because I love everything that Helen has to say. So I find I learned a tremendous amount from the NHS.
Yeah, it's a great one to follow. Do also follow the systems convening one if you want to hear more. It's much smaller than Helen's.
A little earlier, while everyone's typing, Gavin Russell asked about creating an adaptive space, and that was mentioned in our breakout room as well. I just touched on but didn't fully explain. There are previous Q Zoom recordings on the Q website from Mary, whereby I think there are 3 now, and one of those is specifically around creating adaptive space. So that's a really good place to go to hear from the expert herself, how she suggests that people go about creating that adaptive space, and therefore what you need to do and what you need to be able to do.
And I think she talked a bit in maybe the second video she did with Q
Yes.
about how to create adaptive spaces when you need to do it slightly under the radar, because maybe got a more sort of top-down traditional approach. So that was quite useful, actually, that advice. There will be a slide deck and somewhere of it. I can't quite grab it right now, but
Matthew, while everyone's typing, one of the interesting things that it's currently just processing right now, so excuse me everyone, was this concept that a lot of what we did around convening was done in secret, that we were essentially a bunch of convening spies, and that this has brought that into reality. But there's also this idea that COVID and the pandemic's shining a light on the positivity and the benefit of convening where we are right now. So we've got a real opportunity to no longer need to be spies sneaking around in the background, and that we can be more forthright about adaptive spaces and convening and all the tools we use. So I think that's a high point for me today.
And maybe there's something about the integrated care system kind of structure that's going to be mandated from March or whenever it is. You know, that these kind of systems convening competencies and skills will be so much more important, I would think, and yet they're not really prevalent yet. So it seems quite timely to be sharing the book and so on, you know, as the ICS structure grows.
So I've just been scanning down the chat there, and unfortunately we're into our last minute and we did want to finish on time. Some really interesting feedback there, some very interesting comments as well. So yeah, so I'd highly recommend looking up and down there, and maybe some ideas for some future sessions too. So just to conclude, I'll just go back and share the screen, get the slides up, and leave you with some information going forwards, which Matthew, I think you're going to take us through. Here we go. Okay, can everyone see that okay? On to the next one. Want to learn more? Yeah.
Yeah, so there were a couple of next steps, a few next steps that I had, and Diane as well. So from me, I was going to mention there is a Twitter account, Systems Convening, although the handle is sysconvening because it's too long. So if you want to hear more, do follow on Twitter, sysconvening. There's a group space as well that the Wenger trainers set up, a Systems Convening group space. We'll put the links in the chat in a moment. There is Isabel Ho, who spoke earlier, will be doing a Zoom in January the 27th. We just set it up. So sharing her experiences around systems convening, and it's another opportunity for us to kind of connect and discuss and learn from another perspective on systems convening. So do register for that. And also there's, if you're interested in getting more involved, after the launch of the book a few months ago, a Google Doc was created with a lot of the suggestions, and people were suggesting next steps or groups they wanted to set up or Zooms and things like that. So if you want to see if there's something that floats your boat and you want to get involved, or if you want to suggest something around systems convening, do have a look at that Google Doc and just add your info. I'll just put the links in the chat. So those were some things for me, and Diane has a few things as well to share.
Yes, just and we'll share these slides in the recording, I believe, Matthew. Yes. So you'll get the web links. There's the link there to the guide that we've covered, link to the Horizons website where there's lots of information. It will be a webinar on the guide, which will go into more detail. That's the 30th of November, 4 o'clock. The Horizons are running, so please come and join us. It's free as well. Follow NHS Spread for all things to do with spread and adoption. Talk about adoption and spread. Those are my contact details. So thank you so much for joining us this afternoon. It's been a fantastic session, and wow, that hour has gone by so quickly. So thank you from me. Back to you, Matthew.
Just to say thank you, Diane. Thank you, Jorian. Thank you, Maddie, and everyone else who spoke. And thanks everyone for joining in, sharing your questions, taking part in the breakouts, and do join us for future Zooms. Thanks everyone. See you again soon.
Thanks.
Thank you.
Jorian?
Yes.
I can't work out how to leave.
Do you want to stop the recording, Jorian?
Oh.